Good afternoon. My name is Marla McGinnis, and I will be your moderator for today's news conference. Before we begin, I'd like to introduce the Honourable Barbara Adams, Ministers of Seniors and Long-Term Care. Dr. Strang is taking a much-deserved week off, and so it is my pleasure to introduce Dr. Shelley Deeks, Nova Scotia's Deputy Chief Medical Officer of Health, who will be stepping in for him today. Go ahead, Minister.
Thank you very much, and we hope that Dr. Strang gets that break that he deserves so well. Good afternoon. Last week, we were informed of an outbreak of COVID-19 at a long-term care facility. The facility is the East Cumberland Lodge in Pugwash. Right now, there are 5 confirmed cases of COVID-19 at the facility. 4 are residents and 1 is a staff member. As soon as the first case was identified, immediate action was taken, and this response continues. The facility is working closely with local public health to ensure that the residents get the care that they need and to prevent any further spread of the virus. Contact tracing is now underway and staff and residents are being tested. Despite having high rates of vaccination among long-term care residents and staff, the 4th wave of COVID-19 pandemic is still having serious impact, especially among older Nova Scotians. In this case, we know that 96% of staff at East Cumberland Lodge have shown proof that they are fully vaccinated, and 100% of residents of the facility are fully vaccinated. Seniors, and especially those who live in long-term care facilities, are among the most vulnerable citizens of our promise. We are ready to provide the support the facility needs and will continue to work closely with the facility, public health, and the Nova Scotia Health Authority to carefully manage this outbreak. This current situation underlines the importance of getting vaccinated and following public health direction, and why we continue to strongly encourage all Nova Scotians to make the right choice to protect themselves, their families, and their communities. Thank you.
Thank you, and good afternoon, everybody. We announced 111 new cases today over the past 3 days. As Dr. Strang said on Friday, we were already seeing some community spread in the Amherst and Cumberland County area, and we've also seen secondary transmission related to a faith-based gathering that occurred in late October. Unfortunately, some of the secondary transmission is the source of the outbreak at East Cumberland Lodge in Pugwash. A staff member was infected, and 4 other residents have now become infected. I say at least because I fully expect we will see more cases at this facility. The good news is that vaccination coverage of residents and staff is very high in this facility. Breakthrough cases in vaccinated people are not unexpected, as the number of vaccinated Nova Scotians continue to rise. That is why rolling out booster doses to long-term care residents is so important, as older people have increased risk of waning or decreased protection over time. The 3rd dose provides a boost in protection against COVID-19. Long-term care homes are now in the process of rolling out both flu vaccine and COVID-19 booster doses. The most important thing residents in Amherst and Cumberland County, and in fact all of Nova Scotia, can do is get vaccinated if you haven't taken that step already. In addition, it's really important to remember that if you're sick, please stay home and book a test. Do not go to work or school or visit your loved ones in a long-term care facility or hospital. Thank you.
We'll now take questions from the room. I'll call on each reporter individually. We'll start with Taryn Grant with CBC.
Dr. Deeks, does this outbreak at the long-term care home add a new sense of urgency to get those booster doses in the arms of residents?
Well, we know that there is going to be breakthrough cases as there is disease circulating in the community. What's important to remember is that there needs to be a 6-month time period between the first your second dose and your booster doses. So it is important to roll these out so people will get protected.
Would there be any utility in speeding up the timeline for getting booster doses to this particular facility in Pugwash?
No, because the disease is already there in the facility. So boosting somebody right now, there wouldn't be any benefit. But it is still important for these residents to get their COVID-19 booster dose, because subsequent disease will be impacted.
The minister talked about contact tracing and testing. Can you lay out any other specific actions that have been taken at that home?
So there's contact tracing, testing, public health measures, cohorting. It's now closed to any visitors, and those are the key public health measures.
Okay, we'll move on to Devin Stephens with All Nova Scotia.
Dr. Deeks, you said, I believe you suggested that the staff member was the first person to be infected. Was that person vaccinated?
I can't comment on an individual vaccine status of a case
Why not?
because it's personal health information.
But I don't know that person's name. You're not revealing anything about them.
I'm not able to comment on that.
So, Minister, if there's 96% vaccinated in that long-term care home, are you going to move up the, the exclusion of workers who aren't vaccinated, the 4%, and get them out of that home at this point?
So we don't have any plans to bring that timeline forward because there's a lot of work in place to make sure that everybody who isn't vaccinated yet has the opportunity to at least get that first vaccine in. So we're not going to be bringing that timeline forward faster.
Okay. And the faith-based community, what are we doing to, are they vaccinated, I guess, first of all? Is this a community that's predominantly not vaccinated?
So I can't answer that because I don't know the details of the particular community. So
You don't know which community it is?
I'm not at liberty to talk about the actual community itself in terms of the details of what's gone on. Public health has that information.
So, I mean, this community has now caused an outbreak at a long-term care home. And I don't need to tell you two what happened in Northwood. A month ago, some kids at Dalhousie had a party, and we all clutched our pearls and said they were putting people's health at risk. Why aren't we doing that here today with this community?
So there's been a lot of ongoing discussion with the faith-based leaders. As Dr. Strang noted on Friday, the community has been very, very cooperative in terms of the public health investigation. And, a large proportion of that community is vaccinated. In terms of the other things that have been done, on Friday, Dr. Strang did reach out to faith-based leaders to clarify when proof of vaccine requirements are needed and when they're not, in addition to emphasize in faith-based services that masking is required by all congregate people who are attending those services.
And if I go to a church, do I have to show proof of vaccination like I did to come into this room today?
No, at this time, because faith-based services are not discretional services by many. So in Nova Scotia at this time, that's not, a proof of vaccine is not required, but you do have to wear masks while you're inside.
Are you going to reconsider that? I mean, there's an outbreak in long-term. I don't want to be dogmatic about this, but it seems serious, and we're just doing what we were doing before.
So we're always looking at the policies that we have in place, and we always have to be ready to pivot should that prove to be necessary. We're waiting for the results of the testing of the other residents and staff, and depending on those results, we may have to take other actions.
Okay, we'll move on to John McPhee with the Herald.
Can I get clarification in terms of the outbreak at the home? Is it, do you know if it's related to the faith-based gathering, or is this another community spread episode that's related to the home?
There is a link to the faith-based gathering, yes.
And when you said that
Did I get you to say that again, just because I didn't?
Sure. There is a link to the faith-based gathering, yes.
Okay. And when you said that Dr. Strang and Public Health are in contact with the faith-based community, you're talking about all faith-based leaders. You're not talking about the leaders who are connected to the churches that went to this gathering. I just want to be clear on that.
Both situations, yes.
Okay. And again, in terms of whether we know or not talking about whether the congregants who attended that gathering were vaccinated or not. I mean,
I don't know the exact vaccine coverage status of all the congregants of that community.
Are they not being surveyed?
I just don't have that information.
Okay, Jesse Thomas with Global.
Okay. Late October, there was a faith-based gathering. I'm just wondering how many people were in attendance there, how contact tracing is working from that particular event to determine, I guess, the scope of the spread, because we talked about, Dr. Strang has reached out and talked with this community. It's my understanding it's reached several communities. Sorry, I guess it's a bit of a long-winded question, but.
Yeah, so it was a multi-day gathering, and there was approximately 100 people that attended the gathering. And in terms of contact tracing, as I indicated before, the leaders have been very cooperative in terms of contact tracing, and the investigations are still ongoing.
It's still ongoing, okay. What does that say for today's numbers and going forward? Do we have any understanding of just, of the 111, how many are directly related to that faith-based gathering versus how many more do you think we might end up seeing? Could it continue to climb, Dr. Deeks?
Well, that's a great question. In terms of the people that were at the faith-based gathering, we've seen a number of cases, but we've also seen some secondary transmission. So individuals who went to the gathering went back to their community, and there's been ongoing transmission from individuals who were ill there. So I fully expect that we will see more cases associated with this outbreak. And that's one of the reasons that we're having this discussion today.
Did that staff member attend the faith-based gathering?
There's a link to the faith-based gathering.
Okay, we'll go to Lindsay Armstrong with The Coast.
Thank you very much. Minister Adams, Dr. Strang spoke about wanting to work with these faith-based communities and not penalize them. I'm asking you as a member of government, why are we not looking at fining these the parties involved here? This is 100 people at a multi-day event in a situation where proof of vaccine should have been required but wasn't, and Dr. Strang said Friday that the majority of these people were not vaccinated. So is fining something that's being considered?
So right at the moment, I don't have the information that Dr. Strang is recommending that. So we have to look at that as one of the options moving forward.
I'm wondering how many people work at the Pugwash long-term care home.
I believe it's around 116, and the majority of them were vaccinated. I think it was 97%.
97. I just want to clarify, is that 97 that have proven
I think it was
it?
96.
Or 96.
Yeah.
Yeah, so they've all, that 96% of the 116 have proven that they are double vaccinated.
And does that mean that the remaining few have not been asked for that yet?
No, they've all been asked for it. We will have full numbers by a week from now or sooner, but they've all been asked to show proof of vaccination. Some may not be vaccinated, others may not have brought in their proof.
And sorry.
I was just going to add, because I don't know if you mentioned this, but I think it would be helpful for you to know, 100% of the residents of that facility were fully vaccinated.
Thank you. And I'm wondering, too, in terms of the process with contact tracing, I understand that that's still a work in progress. About how long do we expect that to take, given that there are about 100 people at this event?
Well, your contact tracing is related to the actual event. So once there is secondary transmission, there's a whole new work involved in contact tracing of the subsequent events, right? So the contact tracing of the original event is ongoing because the people could still be incubating the virus who were at the event. Then with secondary transmission, if a new site is identified, so in this case, the long-term care facility, then you need to implement contact tracing in that new site where there's secondary transmission, and you need to follow up while individuals may be, again, incubating the virus to make sure you capture everybody who has become ill. So it is a long process because you have to wait for the virus to infect somebody if they've been exposed and they are not, and they're susceptible to it.
And in terms of the clusters that are tied to this faith-based gathering, on Friday, Dr. Strang said at that point it was Amherst and the northern part of Cumberland County. I'm wondering if there are clusters outside of those regions at this stage.
Yeah, so I believe that Dr. Strang on Friday said that the clusters have been associated in northern zone and western zone. So there have been some secondary transmission in western zone as well.
And at this point, those are the only two zones that have clusters related to this gathering?
Yes. Yeah.
Thank you.
Okay, we'll go to Hannah Brighton with the University of King's College.
Hi. So because of the large number of cases, will there be any community restrictions coming from this?
So at this time, there is no change to the public health measures.
That's it. Thank you.
Okay, we'll go to the phone lines now. We'll start with Danielle Edwards with the Canadian Press. Go ahead, Danielle.
Hi, I just wanted to ask if there's a plan to go back to having the number of COVID cases reported every day. I noticed that in the last few months, we've been getting the weekend numbers on Monday, especially with so many cases being reported over the last 3 days. Is there a chance that we will go back to daily reporting?
So that issue is under discussion right now. So at this point in time, we are still on our Monday to Friday reporting. But as always, we watch the trajectory of the outbreak, and if changes are needed in terms of reporting, but also in terms of public health measures, we will make those changes.
Great. Danielle, do you have a follow-up question?
No, that's everything. Thank you.
Okay, we'll go to Daryl Cole with the Amherst News. Go ahead, Daryl.
Hi there. My question is for Dr. Deeks. There have been a number of exposure and close contact notices sent out to students at several Amherst schools since last week, and I've been told that 4 of the 5 schools in Amherst have sent home notices. And Friday I learned that similar notices were sent to students in Oxford and Spring Hill. Has any thought been given to closing the schools, and I guess what is being done to control the situation?
So there is no thought at this point in time to have a general closing of schools. In terms of school public health measures, when there's a case, there's an investigation to determine if there is ongoing transmission in the school. There's communication about the case. If it is deemed that there is an outbreak in the school, then some schools have been closed for a short period of time.
Daryl, do you have a follow-up question?
Yes, I know you've talked a lot about the connection to the faith-based gathering with Pugwash, the situation there. The outbreak in the schools in Amherst, is that connected to this faith-based gathering as well?
Not to my knowledge.
Okay. We'll go to Tim Bousquet with the Halifax Examiner next. Go ahead, Tim.
Hi, good afternoon. Dr. Deeks, I'm seeing that in past days previous to this report, the new cases were concentrated primarily among younger people up to age 39, I guess. But the older people today are highly represented, 30 over 60 and 6 over 80. Is there an explanation for that? Is there an explanation?
Well, when they're associated with some of the gatherings, it really depends on the demographic of the person who is of the people that are actually attending the gatherings. What we know about this virus and about vaccine, that for our older people, they are very well protected against with 2 doses of the vaccine. But we have seen that there is some waning protection, and we've seen across the country, but now some suggestion in Nova Scotia too, that there is cases of disease occurring in fully vaccinated people. And that's why we're implementing booster doses to assist with protecting those people. The vaccine effectiveness tends to hold for severe disease, and when there's waning, it tends to be more pronounced for kind of mild disease or even asymptomatic disease.
Tim, do you have a follow-up question?
I do. I guess I'm going to rephrase the question asked by one of my colleagues, which is about vaccination status at the faith gathering. These numbers come out on Friday, so we'll know, and Dr. Strang in the past has been able to tell us, if new cases were vaccinated or not, if there's an exceptional reason. So do we know that those older people were vaccinated, or are they largely unvaccinated?
I don't have the number. I don't have the proportion of the people that attended that were vaccinated, sorry.
Okay, we will go to Marie Adsett with CTV next. Go ahead, Marie.
Good afternoon. I was assigned late, so my apologies. I just wanted to ask quickly, you've maybe already covered this, but wondering about the status of the residents. How severe is their infection? I know they had 2 doses, but how are the residents doing, and can you confirm the number of residents impacted?
Sure. As of this morning, there were 4 residents impacted. 1, unfortunately, is in hospital, but the 3 are being managed at the home. But as we indicated, there are a number of tests pending, so we'll update as further information becomes available.
Marie, do you have a follow-up question?
Is that person in hospital in intensive care?
I don't have that information.
Okay, we will go next to Lois Ann Dort with the Guysborough Journal. Go ahead, Lois Ann.
Yes, hello, thank you. Last week it was noted that between October 28th and November 3rd, 30% of new cases were in those double vaccinated. What implication does this have for the booster program and public health mandates such as masking and size gatherings?
That's a great question. In terms of looking at the proportion of the population of cases that are double vaccinated, it only tells us part of the story, because what we know with these vaccines and even the need for booster doses is that waning impacts older people more than younger people. And so when we look at the distribution of people who are fully vaccinated and getting ill, what we expect is more people will have what we call vaccine failure in who are older than younger.
Lois Ann, do you have a follow-up question?
Yeah, my follow-up is that data going to be available to the public?
Yes, so the data about breakthrough is available on our website. In terms of what's happening in the rest of Canada, that information is also available at the Public Health Agency website. And with bigger populations, I would encourage you to look at the Canadian data as well, because there have been more cases, fortunately, for us, in some of the other provinces, and we can really understand about what's happening with waning immunity when we look across the country.
Okay, and we'll go to Bill Martin with 6 Rivers News next. Go ahead, Bill. Bill, are you there? We'll finish up with Blair Rhodes with CBC. Go ahead, Blair.
Yes, good afternoon. I was just wondering, I realize only one employee has been tested positive at this point, but are there any contingencies in place should, as you predict, the infection spread through staff at this nursing home to perhaps bring in outside help?
So right at the moment, we only have 1 staff member, and so our department staff are already working there, and they do have sufficient staff now. If testing indicates that there are more staff affected than we are aware of now, then we would look at the other options that have been implemented to make sure that they have full staffing complement.
And do you have a follow-up, Blair?
No, I'm good, thank you.
Okay, are there any final questions in the room?
Just that 4% in the long-term care home, I mean, is there any plans to quarantine them away from some of the residents, or for their own safety if there's about a dozen of them not vaccinated in that long-term care home?
sorry, when you said there are a dozen that aren't vaccinated, all of the residents are vaccinated. Who are you?
I mean, the staff. The staff that isn't vaccinated, are we going to move them away from the patients? Are we going to do something with the staff that isn't vaccinated to curb the spread?
So that's a question that we're considering, and it'll depend on the results that we get at the end of the day.
And what results are that?
The testing of the other residents and staff, those results we're expecting by the end of today.
Okay, thank you very much.